Hello, my name is Dr. Harold Benson. I've been working with men over 40 for years, not just in my office, but also in gyms, on treadmills, and in kitchens as they try to change their habits. Over that time, I've seen the same thing over and over again. Strong, sensible men who desperately want to stay in shape, but out of old habit, exercise like they're 25 again. The result is often the same joint pain, frustration, and the fear that it's all over. Today, I want to talk to you not about prohibitions or empty motivational slogans, but about how to train smart so that your strength returns and lasts, and your joints serve you smoothly and reliably. I'll explain the mechanisms behind the changes we all experience with age, why some gym habits become harmful after 40, and what simple, practical steps will help you train safely and effectively. The first thing to understand is that age is not a death sentence. I don't say this as a triumphalist slogan, but as a doctor who has seen hundreds of examples to the contrary. Men who adopted small changes in their approach and didn't change their will to train, but simply took a wiser approach to technique, recovery, and planning maintain mobility, reduced pain, and even increased strength at an age when many are accustomed to decline. It's possible, and you can too. But first, let's be honest about the facts. After 40, our bodies undergo many small but important changes. Ligaments and tendons become less elastic, metabolic processes slow down, tissue's ability to recover from microtraumas deteriorates. This means that what you did at 25 with minimal consequences can now cause cumulative damage. And the key word here is cumulative. It's not that one exercise will immediately break you, but that repeated incorrect stress on a joint, a lack of a proper warm-up, and neglect of recovery all add up to a problem over the long term. However, age doesn't determine everything. Lifestyle, sleep, diet, stress levels, weight management has a significant impact on joint health and how you handle exercise. Often men say during consultations, "Doctor, I don't want to exercise less, I want to exercise smarter." That's a great position, and that's exactly where I want to help. Not by depriving you of the joy of movement, but by giving you the tools to ensure that joy brings health, not pain. Nobody likes a boring lecture, so I promise, this will be practical. I'll explain not just what to do, but also why. Why smooth technique is more important than loudly demonstrating weight. Why slow, concentrated movements are sometimes better for joints than loud, forceful ones. Why a warm-up isn't a waste of time, but a safety net, and how recovery is just as important, and sometimes even more so, than the workout itself. In this series, we'll cover three main sections. The first is a gentle anatomical tour, a brief and clear overview of the joint structure, how cartilage and ligaments respond to stress, and the role of muscles as a natural framework that supports the joint. The second is a practical section, a training strategy after 40 wash, which exercises to keep, which to modify, and which to eliminate. How to structure a workout based on the principle of control first, then strength, and examples of safe techniques. The third is a recovery and long-term care plan, nutrition, sleep, supplements that actually work, not just marketing hype, as well as mental and behavioral practices that help maintain results for years to come. I want you to leave this conversation understanding that caring for your joints isn't a hospital emergency, but part of your strength strategy. It's not about giving up heavy lifting forever. It's about making smart adaptations. Sometimes you need to temporarily reduce the weight. Sometimes you need to change the movement. But ultimately, you'll be able to lift harder and longer because your body won't pay the price with hidden damage. Let me add one small but important thought. Taking care of your joints is a sign of self-respect. Many men perceive caution as weakness. I often tell my patients, caution is not capitulation, it's an investment. An investment in years when you'll be active, vigorous, and able to play with your grandchildren, run with your dog, and travel in any weather. Being wise in this approach doesn't make you less of a man. It makes you more of one, because you're thinking long-term. I've seen people in my office with varying starting points. Some come in after an injury, others after decades of strength training with sore knees, and still others simply want to feel better in their bodies. What they all have in common is a fear of losing control and a desire to act quickly. My job is to transform this fear into a plan that takes into account your age, history, goals, and most importantly, respects your joints. One more thing before we begin. Don't expect quick miracles. Sometimes improvements are noticeable after just a few weeks, especially if someone hasn't been warming up, hasn't slept well, and has been deficient in protein. But often recovery is a gradual process, and it requires patience. Patience isn't the absence of action, but the consistency of the right actions. If you're ready, let's move on. In the main section, I'll detail which exercises are right for you, how to build a monthly and yearly program, how to assess your condition, and when to consult a doctor or physical therapist. I'll provide specific practical recommendations from warm-ups to strength techniques and stretching, all in a language that's easy to understand and implement. And one more thing. Throughout the process, I'll be sharing real-life examples, short stories from my patients, who will remain anonymous, so you can see how these principles work in practice. These stories aren't meant to be sensational, but to help you understand if someone changes their approach, they can truly change the outcome. In closing this introduction, I want to reiterate something simple. If you feel like age has become a limitation, that's okay. At some point, everyone realizes that some things have changed, but the key is to not give up. A wise, consistent approach will allow you to maintain strength, agility, and confidence. You're not losing yourself, you're adapting, and that's worthy of respect. Ready? Then let's get down to the nitty-gritty, starting with how joints are structured and why muscles are more important than weight. When I tell men that joints after 40 require special attention, I often see a slight smile. Doctor, I'm just lifting weights. I'm not an old man yet. And I understand this reaction. Inside, we're all the same people we were at 30. But the body is more honest than memory. It doesn't argue, it simply signals, with pain, clicking, stiffness, morning stiffness. This isn't a betrayal of the body, but a request for attention. With age, collagen levels, the protein responsible for tissue elasticity decrease. Ligaments become denser, and cartilage loses moisture and becomes less shock-absorbing. While joints might once have been forgiving of technique errors or missed warm-ups, now every little detail matters. Even a slight shift in angle during a squat or bench press can eventually lead to inflammation or microtrauma. Hormonal imbalances are added to this. Decreased testosterone and growth hormone levels reduce recovery speed. Muscles grow more slowly and tendons take longer to heal. But this is no reason to give up. It's simply a new game. Adaptation is key. Our body is still capable of becoming stronger. It just needs a little more care, sleep, and attention. 3 golden principles of training after 40. I call them the 3 R's formula: warm-up, rhythm, recovery, rest. Warm-up. 5 to 10 minutes before the main part of your workout isn't a luxury, but a preventative measure. Joints work like hinges. If the oil has thickened, the mechanism creaks. A warm-up lubricates the joints, gets the blood flowing, and prepares the nervous system. I recommend a simple routine. Joint gymnastics from top to bottom. Neck, shoulders, elbows, hands, pelvis, knees, feet. Light cardio, 3 to 5 minutes. Then, do a specific warm-up for your exercise. If you squat, do 2 to 3 sets with an empty barbell to get a feel for the movement. Only then add weight. This will save you years of health. Rhythm. At 25, we train on drive, but at 40, we need to train with awareness. Sudden movements, jerks, throws, anything that looks impressive quickly destroys joints. Work at a controlled pace. 2 seconds to lift, 2 to lower. Don't chase weight, chase technique. Good technique is an investment in decades of pain-free exercise. Many men say, "But I feel weak when I lift less." Nope. Strength isn't about the kilograms, but about the ability to control your body. Try doing dumbbell presses slowly with pauses, and you'll understand that weight isn't the most important thing. Rest. This is the most underrated part. Muscles grow not during training, but after. Joints recover not when you lift weights, but when you sleep. Lack of sleep, chronic stress, and protein deficiency make you vulnerable. After 40, the optimal regimen is 2 to 3 full-strength workouts per week, with a rest day or light activity in between: swimming, stretching, walking. If a joint hurts, don't be a hero. Sometimes the best training for joint health is a rest day. I'm not a fan of categorical no statements, but some movements after 40 require caution. Weighted jumping, plyometrics, due to the impact load on the knees and spine. Deadlifting heavy weights with a weak core puts you at high risk for back injury. Behind-the-head presses and deep shoulder abductions overload the rotator cuff. Running on asphalt without proper shoes can cause micro-trauma to the knees and ankles. Replace them with gentler alternatives: bodyweight squats, incline walking, swimming, and resistance band exercises. Your goal isn't to demonstrate strength in one rep, but to develop sustainable, vital strength that will allow you to move freely. Many people think that joints suffer from exercise, but they often suffer from lack of it. Muscles are shock absorbers. The stronger and more stable the muscles around a joint, the less pressure on the cartilage. Strong quadriceps relieve stress on the knees, strong glutes relieve stress on the lower back, and stable shoulders relieve stress on the elbows and wrists. Therefore, if you care about your joints, you need to build strength wisely, not avoid it. The key principle is balance. Don't just train what you see in the mirror. Strengthen your stabilizers, your core, back and hip muscles. They hold your body correctly and reduce stress on your joints. Often pain isn't caused by wear and tear, but by imbalance. One muscle group is pulling harder, another is pulling weaker. Correct your balance, and the pain will go away. Over the years, muscles lose elasticity and ligaments become stiff. This makes movement more difficult. I recommend spending at least 10 minutes after a workout stretching. This isn't about achieving flexibility records, but about joint health. Gentle stretching improves blood flow, helps tissues recover, and reduces the risk of injury. Static stretching after a workout or light yoga, Pilates once a week is best. If you have a sedentary job, do micro stretches. Stand up every couple of hours, stretch, and roll your shoulders and neck. Small habits create big results. Training without nutrition is like building a house without bricks. For joints and ligaments to remain strong, they need building blocks. Protein, at least 1.5 grams per kilogram of body weight per day. Omega-3 fatty acids reduce inflammation. Vitamin D and calcium for bones. Collagen, glucosamine, and chondroitin support cartilage tissue. Yes, some supplements actually work, especially for those who are deficient. Drink enough water. Dehydration makes cartilage dry, losing its shock-absorbing properties. And don't forget about your body weight. Every extra kilogram puts additional strain on your joints. Even a 5 to 7% weight loss can significantly reduce knee and lower back pain. The hardest skill to master after 40 is coming to terms with the reality of your body. This isn't defeat, but wisdom. If you feel your energy is low today, don't push yourself too hard. Do a light workout, work on your technique, stretch, and take a walk. Tomorrow you'll be grateful you didn't break yourself for one heroic approach. Listen to your cues. Pain isn't an enemy, it's a clue. Distinguish between work fatigue and anxiety pain. Work fatigue goes away within a day or two. Pain that gets worse or interferes with sleep requires medical attention. I often hear, "Doctor, I just don't feel like exercising." It's not laziness, it's a combination of factors: stress, lack of sleep, low testosterone, poor nutrition. Start simple. Improve your sleep, eat protein, drink water, and cut out excess sugar and alcohol. You'll be surprised how quickly your energy returns once your body stops wasting energy compensating for bad habits. And remember, exercise should give you energy, not drain it. After a proper workout, you'll feel light and energized, not exhausted. If you're feeling drained, reconsider your workout. No workout should be haphazard. Write down what you do, exercises, sets, and how you feel. This will allow you to track your progress and quickly spot any pain or weak points. Consistency is more important than intensity. 3 moderate workouts a week are better than 1 binge day at the gym. Turning 40 isn't a finish line, but a new journey. If you start taking care of your body mindfully, in a year, you'll be stronger than you were at 30. When I look at men over 40, I always see the same thing: a combination of inner strength and a slight weariness. This isn't weakness, but rather the result of accumulated experience. We've been through a lot, built a lot, and lost a lot. And somewhere along the way, we begin to feel our bodies aren't what they used to be. It's harder to get up in the morning, workouts are harder, and pain appears where it never was before. But this isn't a tragedy. On the contrary, it's a moment of awakening. A man's true strength lies not in ignoring pain, but in hearing it and acting wisely. Many people fear age. They think, well, that's it. I'm getting old now. My joints are cracking. It's time to go down. But the truth is, age gives you things you didn't have in youth: awareness, patience, and the ability to analyze. You already know that strength isn't about lifting more than anyone else, but about staying on your feet when others fall. After 40, you don't get weaker. You get smarter. You begin to understand that every workout isn't a battle with your body, but an alliance with it. You're not fighting for muscle. You're collaborating with your body, helping it adapt, strengthen, and serve you longer. When I talk about strength, I don't just mean physicality. Strength is also the discipline to go to bed on time. Strength is the ability to stop when pain says enough. Strength is the willingness to return to the gym after a setback, but with a new approach. Many men I work with say, "Doctor, I used to chase weight, numbers. Now I just want to feel good." And that's where real growth happens. Because working out stops being a way to prove something, it becomes self-care, an act of respect for your body. If you think about it, joints are a lot like relationships. If you don't take care of them, don't give them attention, don't care for them, they start to creak. If you listen to them, respond promptly, and give them rest and nutrition, they'll serve you for years without any problems. I've seen men come in with chronic pain, barely able to bend over. But once they change their habits, introducing a warm-up, eliminating sudden movements, and adjusting their diet, they were back in the gym smiling within 6 months. Joints are grateful when you help them. They don't demand the impossible, just attention and consistency. One of the biggest pitfalls is rushing. We're used to living at a pace of faster, higher, stronger, but joint health doesn't tolerate rushing. A different principle applies here. Slower is better. When you move mindfully, feeling the trajectory, the breath, the muscles, you're not just training your body, you're learning to be present in it. This is maturity. Slowing down isn't a sign of old age, it's a sign of control. When you exercise slowly, you're in control of the process, not leaving it to chance. After 40, it's important to stop comparing yourself to who you were 20 years ago. That person was different. They had different goals, hormones, body, even brain. Comparing yourself then and now is like measuring summer by winter standards. Today you can be stronger, not because you lift more, but because you understand yourself more deeply. I often tell men, respect your body the same way you respect your experience. You don't expect a 1990s car to accelerate like a new sports car, but you know how to take care of it so it lasts a long time and is reliable. It's the same with your body. It deserves care, not criticism. Joint health isn't built in a week. It's a system of small habits: exercise, nutrition, sleep, mindfulness. Each of these elements seems small on its own, but together they add up to a significant, lasting result. If you follow this simple principle, a little, but consistently, your joints will reward you with freedom of movement, an easy gait, and confidence in every step. Consistency is a quiet but powerful force. It doesn't require fanfare, but it builds a foundation. 40, 50, 60. It's not a decline, it's a new chapter. Many of my patients at this age felt harmony for the first time. They stopped chasing, stopped forcing themselves, and began to listen. Their training became simpler but deeper. Their movement slower but stronger. They stopped fighting time and began to live within it. After all, we can't defeat time, but we can become its partners. And the sooner you begin to respect your body, the longer it will be your ally. If you remember only one thing after this conversation, let it be this: you don't have to be a hero to be strong. The strength of a mature man lies in balance, in the ability to act without fanaticism, but with fidelity, in the ability to take care of oneself without guilt, in the understanding that every movement is not a fight against time, but a proof of life. When you go to the gym tomorrow or simply decide to go for a walk, remember you're not aging, you're evolving. Your body is simply speaking a new language. And if you learn to listen to it, it will reward you with reliability and gratitude. Take care of your joints, train with respect, rest without guilt, and live with pleasure. And let every workout remind you not of how many years have passed, but of how much strength remains within you. This was Dr. Harold Benson. Take care of yourself and your progress.